And the politicians say that there's 50 million Americans that are uninsured. First of all, that's a lie. There are no 50 million Americans that are uninsured.
Right.
There may be 50 million inhabitants without insurance.
That's right.
But they're not Americans. And it's in my book. 11.8 million of those are illegal aliens. 80% of the American public is not in favor of providing health care and education to people who enter this country illegally.
Yeah.
Yes! Yet, political pundits get on Fox News. I can expect it from CNN. But they get on Fox News and they get this, and they say this 50 million Americans nonsense, and they let them get away with it.
Yeah.
All right. Anyway, I digress a little bit. I'll give you a couple more concepts here before we leave the 50 million deal. 50 million inhabitants are uninsured. Of those 50 million, approximately 17 million earn more than $88,000 a year. What's the problem? They can buy health insurance. Approximately 16 million of those are eligible for Medicare and Medicaid and just have not enrolled. But the people who want to lambast us with this program tell us that all 50 million of those folks are not eligible for, they make it sound like they're not eligible for insurance. They have no hope. Yes, they do. The majority of them are either here illegally, can afford it, or are eligible for programs, leaving the grand total, according to my estimate, about 5 to 10 million. What does that mean? We're going to revamp the whole system. We're going to give up our liberties. We're going to change the face of this country over 10 million folks. Who, by the way, I am by law required to treat anyway if they come to the emergency room. Not for an emergency, for whatever they think is an emergency. Their toe hurts, I have to take care of them. So, ladies and gentlemen, this is not Somalia. I was in Somalia serving my country. There was a lady who was brought to me in a wheelbarrow, dying. Her husband laid her at my feet. The woman had pneumonia. Here I am, you guys, the taxpayers, are paying for the Somalian woman's health. She's dying. We give her an IV, we give her some antibiotics. 3 days later, she walks out of there. And I'm darn proud of you all for supporting that. I asked the gentleman, sir, through a translator, because I don't know how to speak, I asked the